My name is Laura Jackson, and I'm an Executive Vice President at Wellmark Blue Cross Blue Shield. So Wellmark's approach from a Blue Cross Blue Shield insurance company is a little bit atypical of what you'd find most insurers doing. So we basically stepped back and said, we can work inside the healthcare system to help physicians change the way care is delivered, take the waste out, try to make it more affordable. But we also recognize that if you didn't work outside the healthcare system to truly help change the underlying health status of the population, that we don't have a chance in this country to try to figure out how to abate healthcare cost increases. Usually if we are in a room full of people, let's say it's 100 people, and we literally ask people to raise their hands, how many of you actually walked to school when you were a child? The majority of the hands go up. And so we know that in the 1970s, about 50% of school-age kids walked to school. When we play it forward and we literally say, so how many of your kids actually walk to school today? Very few hands go up. So we know that less than 10% of the school children walk to school. When you look at that, what you will hear many experts say, that takes about 3 to 4 miles of free exercise. You've engineered it completely out of a child's week. And so we scratch our heads when we look at childhood obesity and type 2 diabetes really being diagnosed in kids where it was never a diagnosis 20 years ago. You saw in people less than age 50. We have created a huge issue in this country. Smart growth practices, I think, are a way to help people understand that there are certain things you can do, either low cost or no cost in many cases in communities, to live a longer, healthier life. And I think that as we look at the consumption of healthcare costs in this country, we're facing an epidemic of proportions that I don't think we've ever contemplated. And if we can't abate that trend, we need to find tools like smart growth strategies to do that and to really get people to rally around things that actually make a difference. We are actually a huge fan of the Complete Streets policies. If we can help communities understand that if you don't have the sociability, which the built environment either encourages or discourages, and if you don't have the people engaged in trying to make those changes happen, then you lose an awful lot. So Complete Streets, when you think about making it walkable, so one of my favorite tests is kind of the popsicle test, right? Can you walk out of your front door before a popsicle melts and actually walk safely to the places that you would frequent on a weekly basis, to the grocery store, to, let's say, the drugstore, maybe your hairdresser? If you can't do those things, you probably don't have a walkable community, and your community then is probably shaving years off your life because it's not conducive to a healthy lifestyle. What we have done to the infrastructure in this country, we've made easy choices based on money, and we have thought more about the automobile than we've thought about the people. And if we start to think about the people, I think we will make very different decisions, and I think it's absolutely critical.